Welcome everybody to a special Mother's Day version of the Scoliosis Mother's Day version of the Scoliosis World. Of course, I'm your host, Dr. Mark Morningstar. Thank you for tuning in this week. And like I said, here we're going to be. Tomorrow is Mother's Day, so happy Mother's Day to all of the moms out there watching this particular episode. I wanted to sort of have an episode dedicated to, I suppose, for ease of description, I'm going to call this episode Scoliosis Moms. And I think scoliosis moms really could be defined one of a couple of ways. There are, of course, moms out there who have children with idiopathic scoliosis and are frantically online researching what to do, how to do it, what are the best treatment methods, is watching and waiting and doing nothing good enough? Isn't there something I could be doing? My daughter doesn't like my brace or doesn't like her brace. Does my daughter need surgery? Is there more than one kind of surgery? And on and on and on. And I get it. There's an absolute urgency to learn all there is to learn about scoliosis in a relatively short period of time, because the reality is this is usually something that is discovered almost entirely by accident at a well child visit. And it takes most parents off guard, or catches them off guard, and now they're trying to keep up, and all of a sudden they go to an orthopedic surgeon, and maybe the orthopedic surgeon, depending on how bad the curve is either going to do nothing, or is going to recommend wearing a brace, or is going to recommend surgery. And none of those options by themselves are really that comforting, for different reasons. I mean, no parent wants to do nothing. And so the entire idea of watch and wait is very disconcerting to most parents, because who wants to do nothing? And I contend that that's nobody. No parent feels good about doing nothing and just hoping that their child's scoliosis or their curve doesn't get worse. They want to do something. And the fact is, there are things out there that can be done. And in fact, this is what we at Back Genius preach constantly. There are always things that can be done, and they don't necessarily always have to be physical treatments in nature, but at least the child can still do something to minimize the chance that his or her curve worsens. Then, of course, you have the next stage of bracing. Bracing, I'm going to say it right from the outset, in many instances is a necessary tool. Now, is it the most glamorous tool? No. Is it an easy tool? No. But sometimes it's necessary. Now, the hard part, of course, is compliance rate. I don't know a single child that absolutely loves to wear their brace. Some kids are better at wearing it than others for a variety of reasons, but it's not an altogether absolutely loved treatment. But many times it's necessary. So as a provider, there are things that we can do to blunt that impact, whether it be trying to, create a nighttime only type of an option as far as bracing is concerned. Perhaps, and in my recommendation, not only necessarily a nighttime thing, but also potentially combining it with other physical treatments during the daytime, so that at least they're not doing nothing during the daytime. Because obviously most of our active growth is going to occur while we sleep. But during the day, we want to make sure that our curve is at least stable, if not doing things from a muscular or neuromuscular perspective, to keep working on active stability of that curve and trying to use that person's own muscle power and muscle endurance and postural muscle memory to improve the curve during the day. So there are a lot of different mechanisms that get ignored when you're doing just bracing. So it's always a good idea, in my opinion, to do something in addition to bracing. And then, of course, finally, you have the surgery option, right? And, of course, every time a parent hears surgery for their child, that kind of makes you take pause, especially with scoliosis surgery. Scoliosis surgery, especially the posterior spinal fusion surgery is a very, very invasive surgery. And no matter how old a child is, it's not an easy recovery time. I know all of the stories. I see all kinds of photos on social media that parents take when their kid gets up out of the, first wakes up out of OR, and The hard part with surgery, of course, that all parents face is the decision whether or not to do it. Now, of course, maybe they've been told their child should have it. Fair enough. But that might just be an opinion. Maybe the next surgeon says, well, let's wait a while. It's never a bad idea. If somebody recommends surgery, to me, it's never a bad idea to get the recommendation of 2, 3, 4 different orthopedic surgeons. You don't necessarily want to go off what just one of them says. And frankly, that's the same. The same is true for conservative therapy. I have patients all the time that I see that I give them my opinion, and I'm more than comfortable with telling them, look, if you want somebody else to have an opinion on your child's case, by all means, go seek that out. Don't assume that I'm infallible. I'm going to give you my opinion, and I can give you good reasons as to why I have my opinion. But there are a lot of factors as to whether or not that family wants to work with me, or maybe that I want to work with them. And it has to be a good fit. And some of that criteria is the family needs to understand, in my experience, the people who have the best outcomes are the people who have the most information and the most background coming in and are fully confident and are basically 100% in with whatever I recommend. The worst case scenario for me is when a family comes and does treatment and they just assume that, maybe they saw one of our podcast videos, or maybe they were referred here by another family, or in some cases their local doctor, local chiropractor, somebody else referred them here. And they just automatically want to come here because they were referred, but they know nothing about what I do. Well, sometimes that doesn't always work out because they're not necessarily fully vested in what I want them to do, or maybe they don't fully understand or want to appreciate why we want children to do what we're doing. And there are certain methods to the madness, if you will, as to why this stuff works. And if you're not all in, then there are times where it's just not worth doing. And I think that's true no matter what opinion you get. So I think whether you're at a surgery stage or a treatment phase that's not necessarily surgical level, but treatment of some type is warranted, it's always a good idea to get multiple opinions. I just think that's true for anything medical nowadays, because you can find a doctor of any type of a license to pretty much say anything you want him to say. Heck, we've had treatments over times, throughout the history of modern medicine that, years ago were thought to be the best thing ever, and now we know they're terrible, or vice versa. I was just reading here this morning on social media how people put from, I don't remember what the newspaper was, but one of the big national newspaper outlets had posted an article about how eggs are terrible because they raise your cholesterol. And then the same newspaper wrote a different article on how eggs are great because they lower your cholesterol. What is it? Same newspaper, same food. This article says it's bad because it lowers your cholesterol. This one says it's good because it lowers your cholesterol. And this one says it's bad because it raises your cholesterol. They can't both be true. But people flip-flop, right? It wasn't that long ago that doctors used to tell women to smoke for anxiety and to help calm their nerves. Arsenic is one of the original medicines in the original Merck manual. So, modern, medicine evolves as new information becomes available. So I think all of that is to say that I think it's worth getting multiple opinions, no matter if you're in a conservative stage of treatment, in a watch and wait stage of treatment, or on the other end at a surgery stage of treatment. Because the truth is, even at surgery stage, there are multiple types of surgeries available. And not every surgeon is equipped to do all of the alternative surgeries, or any of the alternative surgeries for that matter. And so it's always good to get multiple opinions if possible. So, on one hand, I think that when you're a parent of a child, especially when you're a mom of a child with scoliosis, I think the biggest issue that I've noticed in my practice career, and I've been in practice now for, this October will be, 22 years? 24 years? Gosh. 24 years. I'll have been in practice. And the one thing that I fully understand and appreciate, not only as a parent or as a provider, but also as a parent, is that the idea of having regret that you didn't do something. So, for example, you might see, and everybody gets sucked into this from a certain degree, but you might see online, well, this method of treatment is better than this method of treatment, or this particular brace is better than this particular brace. At the end of the day, I'm here to tell you, based on a whole lot of experience, a few tips. One, the best exercise method or the best brace is the one that your child will actually do or actually wear. If they're scanned and measured for the absolute most cutting edge brace on planet Earth, but they don't wear it, it's not going to work. I don't care how good the brace is. So you have to find a happy medium to say, okay, what treatment are you going to do consistently? Because that's going to be the one that gives you the best chance for success. And so it's up to me as a provider to take the patient in front of me and try to fit what tools and what methods are going to best be utilized for that individual. Too many times we do it the other way around. Too many times we, as the provider, we say, I'm going to plant my flag. I do a Boston brace. And that's the only bracing I do. We got a whole lot of evidence behind it, and it's the only one that I do, and I think it's the best one. And now I'm going to try to give everybody a Boston brace because it's what I'm proficient at. But the reality is not every patient is going to get a successful outcome from wearing a Boston brace. Nor is every patient going to get a successful outcome from a Rigo Cheneau brace, or a WCR brace, or a Scoli brace, or a Silicon Valley brace, or an SCT Cheneau brace. No brace is 100% effective. Just like no scoliosis-specific exercise therapy is 100% effective. So don't be afraid to use a combination of treatments. And to me, it provides a much more consistent outcome if I, as the provider, flip the script and say, look, based on your curve presentation, based on your ligament phenotype, based on your curve flexibility, based on your genomics, based on your lab results, these are the things that we're going to do to positively impact your condition in the most robust way possible. And then we're going to scale some of the treatments based on your curve flexibility and your ligament phenotype and your genomics and your age and your current stage of growth, etc. And we're going to apply all that to say what exercise routines are going to probably work the best for you based on other kids who did these things in a similar present position. Meaning, what's the severity of the curve? What's the curve flexibility? What's the age of the child? So on. Rather than saying, okay, you're a 14-year-old with a 35-degree curve and you're female and maybe you had your first period a year and a half ago, so we're going to do Schroth. And I'm going to do Schroth for everybody because that's what I know how to do. Well, at the end of the day, Schroth is not suitable for everybody. Schroth is a very good therapy. I have no issue with Schroth, but it's not applicable to everyone. First and foremost, a lot of adults are not necessarily fully trained on how to do it. It is a time-intensive therapy in terms of the instruction required to master some of the movements and positioning. And for little kids, let's say 6, 7, 8-year-olds, sometimes the positioning can be very complex and almost impossible to learn. So now you have to rely on mom or dad trying to be taught and then doing it at home consistently with their child. Well, I can tell you as a dad of 4 kids, I don't have time to be doing this kind of stuff all day at home with my child necessarily. And so I appreciate that all things might work fantastically in a vacuum, but at some point these have to be implemented into real life and into real schedules and implemented by kids who have different attention spans and different abilities and different physical gifts and different limitations. And so not everything is going to work in a cookie cutter manner. So for example, in Back Genius, we try to promote the idea that it's my job as a provider to have as many absolute different tools, clinical tools at my disposal as possible. Those tools being, I know how to fit for a variety of different kinds of braces, for example. I know how to provide and implement a variety of different exercise methods, for example. I know how to implement different exercise equipment, for example. I know if and when to refer for different kinds of scoliosis surgeries, for example. I know how to do risk stratification based on genetic predisposition. So I have as wide of a skill set as possible for this particular entity being scoliosis, that I now have the ability to get the absolute best and most consistent outcomes across a whole wide variety of different curve types, different patients, different genders, different age ranges, etc. Because I'm not trying to fit them all into my box. I'm trying to use what I can to fill their box. Big, big difference in philosophy shift in that regard. And I think at the end of the day, you should, as a parent, as a scoliosis mom, I implore you to seek out a provider who is willing to take your child as they are and mold what they're doing to fit your child, not the other way around. Excuse me. Now, the other part of this, the other scoliosis mom out there I want to speak to for a little bit, is the scoliosis mom who herself has scoliosis. Now, whether or not she has kids with scoliosis or kids without scoliosis, it doesn't matter. Mom herself has scoliosis, so she's a scoliosis mom. Now, of course, that mom might be both if she also has a child with scoliosis, but for sake of what I'm trying to describe, mom herself has scoliosis, entirely irrespective of whether her child or children have it or not. When a mom has scoliosis, mom has certain unique needs that she needs to fulfill and to pay attention to across the lifespan. Mom's going to need to pay attention, particularly when caring for young ones, how she picks them up, how she plays with them, how she picks up their toys, how she does all those kinds of things, because obviously there's a certain amount of wear and tear on the back. Mom also is going to have to pay attention to her health during perimenopause. And I think chiefly that's probably the biggest thing. So when I have a scoliosis mom who has scoliosis, one of the first things I ask is, are their periods still regular or not? And how long has it been since their last period? Because I'm trying to get a gauge as to whether or not they are perimenopausal, or maybe they already know that they're postmenopausal. Once a woman is postmenopausal, now it becomes vitally important from a treatment and management perspective to help them with optimal hormone metabolism. Now, there are a range of things that could accomplish that, right? Again, as many tools as possible. I don't care if it's a child. I don't care if it's an adult. I need to have the ability to refer for as a wide variety of things as possible to help the person in front of me. So if a, say, 60-year-old female scoliosis mom comes in to see me who's been post-menopause for, 5 years, we're probably dealing with a few things. We're probably dealing with a lot of hormone symptoms. We're probably dealing with a lot of disturbances of sleep. We're probably dealing with aches and pains. And we're probably dealing with bone density problems. All of these things are sort of part and parcel to scoliosis as an adult postmenopausal female. And so the question becomes to me, to a provider such as myself, is what am I going to do about all these things? All of these things are going to impact that mom's curve. It might be, the bone density might be creating a vicious cycle. So if I don't stop any ongoing bone density loss, I have no chance of helping that scoliosis mom's curve. If I don't help that mom's sleep, I am not going to have as good of a chance of an outcome because she's not going to have as much opportunity to repair and restore all of her musculoskeletal tissues. Sleep is when our body repairs itself. And if you're not sleeping well, then you're not repairing yourself well. And you're just continually breaking yourself down. So what am I going to do about that? What am I going to do about the fact that now her hormones are a fraction of what they were, and that hasn't been addressed? One of the old sayings, if you have listened to any of my podcasts, you'll hear me say this over and over and over, that, the conventional wisdom used to be that we age because our hormones naturally decline. However, the opposite is really more accurate. Our hormones go down and therefore we age. Meaning, if we can keep our hormones optimal, that's going to improve our longevity and our vitality and our sleep and our energy and our memory and on and on and on. You have to remember, hormones are signaling molecules. Hormones in and of themselves don't do anything. They just tell your body what to do. Okay, guys, over here, it's time to activate estrogen or use progesterone or use testosterone or do this or do that or fall asleep, stay asleep, wake up. Hormones do all of these, tell our bodies to do all of these things. If you don't have signaling molecules, it will be like driving in a city that has no streetlights or no stop signs. How do you know when to go or when to stop? And now you have to rely on everybody else. There's no signaling. Hormones are exactly like traffic lights. And the problem becomes when hormones stop signaling for stuff to work, guess what? Nothing works. And now we break down. Now we age. Now we don't repair. Now our brain starts to deteriorate. So if you want to stay healthy and you want to have as best of a chance of a long lifespan as possible, you have to maintain normal or optimal hormone metabolism. And there are many ways to do that. You can do that through bioidentical hormone replacement. You could do that through different enzyme therapies. You can do that through different kinds of exercise regimens, like high intensity interval training. Many things, not even just in terms of hormone therapies themselves, but different physical exercise strategies also impact hormone metabolism. So it just depends on what the outcome and what the prevailing issues are for the person in front of you. And in that way as well, improving hormone production and metabolism and output also makes it less likely to have chronic pain. It also makes it less likely to have problems with mood swings or depression or low mood or sundowners or dementia later on, all on and on and on and on. You have to have normal, healthy hormone metabolism. And that is especially important in scoliosis treatment, especially in postmenopausal adults. So for that segment of the scoliosis population, the postmenopausal scoliosis moms out there, you have to work on all of the facets of the condition. And really what I find, quite ironically, is that even when I have a woman who comes in who has had a curve for most of her life, again, let's say she's 60 years old, and her curve was discovered when she was, say, 12 or 13 years old. So she's had that curve the vast majority of her life. But her body is used to that curve. So you don't necessarily have to treat the curve aggressively to make them feel tremendously better. You just need to work on stabilizing that curve and working on all of these other sort of tertiary circulating kinds of connected problems like bone density issues, hormone metabolism, all of these things that are sort of circling around this curve, that if I address those things, that woman by herself will feel immensely better and function immensely better. And once she feels better and functions better, guess what? Now it's easier for me as the clinician to give her stuff to do at home to also now fix and improve the curve. I can't necessarily do that from the outset if the body is so broken down and the body is not in a reparative state whatsoever. I'm going to be far less likely to get any positive headway on that curve if I don't address all the reasons that are directly impacting this curve. So scoliosis moms out there have to pay attention to themselves. And I get it. Moms in the household, I always say, put themselves last. Maybe that's rightfully so, but they can't ignore their own health. Because as a mom, I don't have to tell you that if you don't feel good, you can't take care of the rest of your household very well. You just can't. You might be able to put on a good front for a while, or you might be able to fake it till you make it for a little while, but you can't do that as a lasting strategy. You have to take care of yourself. Pure and simple. You know, sometimes that the saying comes to mind like happy wife, happy life. Well, in essence, that's true, but I don't look at it from a a wife life perspective that way. I look at it more of mom has to be healthy in the household. Mom is like the cornerstone of most households, really. Mom makes 3/4 of the medical decisions and the schooling decisions. And, maybe mom and dad both, are kind of equal, or maybe dad does more on the financial stuff, just depending on the household. But moms are really the cornerstone of a lot of decision making in the household. If mom is not operating at 100%, all of those things suffer. It's not just mom herself who suffers. Everybody else around her in her orbit also suffers. So it's vital for mom to take care of herself, to take time to take care of herself. So what I hope and what I would ask all of my scoliosis moms out there who watch this episode on Mother's Day, maybe, please take the time to consider yourself. It doesn't have to be a ton of time. It just has to be a little bit on a routine basis. Do a little, a lot. And it will go a long way in helping your outcome and helping your outlook, improving your health, improving how you feel, improving how you function. And guess what? Now you can do all the things better for your family that you want to do. Or even if it's maybe your kids are out of the household by then. Probably are. I would hope if I'm a 60-year-old female, my kids are out of the household by then. But now it becomes my grandkids. If I want to do stuff with my grandkids, if I want to be able to take them places and play with them and enjoy them, you know what? I need to be physically able to do those things. And it's imperative that you pay attention to your own health. So please, on this Mother's Day, moms, scoliosis moms out there, think about yourselves for a change. Because I know you're not used to that. You're used to taking care of everybody else around you. And I appreciate that. Trust me. My wife is an absolute super mom. So I fully appreciate what moms do out there. So, but please take care of yourselves. If you have any questions on how to do that, you know where to find me. You can look me up at backgenius.com, as well as if you're not maybe in my local area, you don't want to see me. There are people all over this country who practice in a very similar manner to the way I do. And you can find them all on backgenius.com. You can find my own practice, very simple, scoliosispractice.com. And I'm happy to do clinical consults with anybody who's interested in just learning more and learning about how they could be helped more so than maybe what they have already been. And my hope for all of you scoliosis moms out there is that for the rest of the year here, 2026, that turn a page, turn over a new leaf, pay attention to yourself. For the scoliosis moms who have kids with scoliosis, don't stop investigating. Don't stop asking questions, no matter how uncomfortable the provider might make you feel, because it's your child, not theirs. And I appreciate the parents who come in here and basically grill me, because it's their job to be their child's advocate. And I have no issues with parents giving me the third degree, wanting to know what I do, what's the evidence, what's the logic, what's the rationale, why does my child need this, how can my child benefit from this? Are there things out there that you don't offer that maybe we should explore? I am more than happy to have those conversations with all my scoliosis moms. They owe it to their child to have those conversations. So just rest assured that if you have those conversations with me or try to ask those questions of me, I am happy to have those conversations with you, because I notice that it almost always translates into a better clinical outcome for that child when the family knows fully 100% what they're supposed to be doing, and more importantly, why they're supposed to be doing it. So, again, happy Mother's Day to all of my scoliosis moms out there. If you have any questions, feel free to look me up anytime. Please, if you enjoy this episode and you haven't already, please subscribe to the Scoliosis World podcast. We keep growing by hundreds of members a month, or subscribers a month. So I thank you very much for being a subscriber. If you already have subscribed, please continue to watch from week to week. And we are getting very, very close to having special guests here, starting here coming up before summertime. So tune into that, and I'm looking forward to having some people on the show besides just me, the talking head, every week. So that's it for this week. Have a great day. Thank you. Happy Mother's Day.